Aspiration is performed to help minimize the risk of intravascular injections, which can lead to serious complications like vascular occlusions, skin necrosis, or even blindness if the filler is injected inadvertently into a blood vessel. Whilst a positive aspiration could be helpful, a negative aspiration does not mean one is not in the vessel, and this could lead to a false sense of security. There are several key considerations. 1. Reliability. Whilst positive aspiration may provide useful information, it is not always foolproof. Factors such as type of filler, the thicker fillers may block the needle gauge, and whether the needle is primed, making sure there is no air gap. It means aspiration may fail to detect the vessel when using a fine needle or cannula, even if the instrument is in the vessel. The second consideration is limitations. Aspiration time should be held for a few seconds to increase reliability. Whilst a positive aspiration does not always mean that the blood is arterial, it could be venous depending on the location. The arterial blood would appear bright red and may pulse into the syringe due to arterial pressure. It indicates the needle or the cannula is in the artery, which is particularly concerning because injecting filler into artery can lead to embolization and severe complications. If it is venous blood, it is usually darker red, flows more slowly into the syringe without pulsing. This is also undesirable, but is less risky than an arterial injection. Venous injections can lead to complications like bruising. To perform aspiration, the needle or cannula is inserted into the desired tissue plane. Aspiration time should be held for a few seconds to increase reliability. Pull back gently on the plunger, and if the blood enters the syringe, this is positive aspiration, indicating intravascular placement. The needle or cannula should be repositioned. So in summary, is aspiration useful? Whilst aspiration can be a useful technique, it is part of a broader set of safety practices including thorough knowledge of vascular anatomy, proper injection depth, and slow injection techniques. Understanding its limitations and a negative aspiration should not give the injector a false sense of security.